Good morning, and thank you for attending. Today I'm joined by Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, to provide an update on the local COVID-19 situation, and Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the vaccine rollout. Provincially, we continue to see a decrease in the daily number of individuals who test positive for COVID-19. Our health units case numbers still remain low compared to other areas of the province. However, it is concerning that our trend continues upward. May has seen the largest number of cases in a single month in our district since the start of the pandemic. The May long weekend marks the unofficial start to summer. However, this does not mark the end to COVID-19. Last week, the province announced that the stay-at-home order and the provincial shutdown would be extended to at least June 2nd. Until we're able to get everyone vaccinated, our only way to lower the provincial numbers and local numbers are for everyone to follow public health measures. By following public health measures and booking your vaccine appointment, we can help make this our last shutdown. So with that, I'd like to hand it over to Ms. Mantha to provide an update on our local COVID-19 situation.
Thanks, Dr. Chirico. So in the last 7 days, we had 32 cases, which brings our total case count to 432, with 270 cases in the Nipissing district and 162 in the district of Parry Sound since the beginning of the pandemic. In the last 7 days, 22% of our cases are outbreak related, and all of these cases are linked to outbreaks outside of our district. This past week, we had a member of a local childcare community test positive for COVID-19. We continue to monitor the situation closely to minimize further spread within the center and into the community. As the warmer weather and the May long weekend approach us, we are reminding everybody to continue following public health measures and the provincial requirements under the stay-at-home order. So as a reminder, under the current stay-at-home order, we are still asked to remain home except for essential purposes such as going to the grocery store or pharmacy or accessing health services, which include getting your COVID-19 vaccine. We can exercise outdoors, or for work, we can go to work that can't be done remotely. Outdoor activities like swimming, biking, and walking can all be done safely when all the public health measures are followed. And finally, just wanting to remind people that if you are feeling unwell and you have even just one symptom of COVID-19, that you isolate immediately and then take the provincial self-assessment to determine next steps and whether you need to be tested. With that, I'll pass it back to Dr. Chirico.
Thank you, Ms. Mantha. So Ms. McLellan, if you could please provide an update on our vaccine rollout this week, please.
Thanks, Dr. Chirico, and good morning, everyone. Last week, we hit another milestone with our immunization program, with 50% of adults 18 years of age and older having received at least their first dose of COVID vaccine in our district. As of yesterday at 3 p.m., we have provided 59,821 vaccinations in our district, and 56% of those individuals 18 years of age and older who are residents of our district have received at least one dose of the COVID-19 vaccine. As of Tuesday morning, everyone 18 years of age and older is now eligible to book their COVID-19 vaccine appointment. A shortened dose interval for high-risk healthcare providers, including long-term care home and retirement home staff and essential caregivers, was also announced last week, and we are working to allocate vaccines to support these second doses. Yesterday, we joined the provincial phone booking system for COVID-19 vaccine appointments. Individuals who are unable to book online can use the provincial vaccine booking system line by calling 1-833-943-3900 for assistance. This system is available from 8 a.m. to 8 p.m. daily. The 478-1400 we announced last week is still available for people who have COVID-19 related questions. This morning, we also launched our online COVID-19 first dose standby list available through a form on the vaccine booking page of our website. The standby list, which is available for individuals wishing to receive their first dose of vaccine, is available each day that clinics are running. People can go to our website on the COVID booking page and put their name and phone number on the list for the clinic they can get to within 15 minutes. A new form becomes available each day at 9 a.m. and is cleared at the end of each day once the clinic is complete. No names are carried over to another day. Please note that having your name on the list does not mean that you are guaranteed to get an appointment. You will be called if we have extra doses to use at the end of a clinic. If you do not receive a call, you are welcome to put your name on the list the next day another clinic is available. The health unit is not accepting phone calls to be put on the list. And with that, I'll turn it back over to Dr. Chirico.
Thanks, Ms. McLellan. So that's it for our prepared remarks, and so we'll be able to take your questions now. And if you have them, please type them into the Q&A at the top of the screen, and our moderator will read them aloud, and we'll try to answer as many as we can. And when possible, please ensure that your name is attached to the questions. So we'll turn it over to Alex, if you could read the first question, please.
Thank you. Our first question, I believe, would be for Shannon. It comes from Clark from Your TV Cogeco News. Good morning to all. Has any direction been given to the Chief Commander crew to allow for a safe operating system in 2021? Thank you.
Thanks, Clark, for that question. So I'm not aware of that level of detail if we've provided specific direction to the Chief Commander, as we provide direction to a lot of different agencies and employers across the district. I definitely can look into it and get back to you, Clark, about that. In general, we always provide assistance and support related to infection prevention and control as businesses as they reopen, as well as when they're open under restrictions. So we can get back to you with further details.
Thank you. Our next question is also for you, Shannon. It comes from Jennifer from the Nugget. Shannon, Mantha said most of the cases we've seen in the last week are outbreak related outside of the district. Does that mean people are traveling? Can you clarify the spike in cases?
Sure. So while we don't provide case level details for privacy and confidentiality reasons, there's a variety of reasons people may be traveling out of the district, which might include work, or they may be traveling to visit loved ones who are either palliative or quite ill. So without any further speculation, I think that's just where I'll leave that. But there's a variety of reasons we see cases traveling.
Thank you. Our next question is for Dr. Chirico. It comes from Eric from CTV. The province is expecting to unveil its reopening plan this afternoon. The question is it too soon, in your opinion, is it too soon to start the reopening process?
I think it's fine to start the planning of the process to inform the public as to what's coming, but it's too early to speculate exactly what the reopening is going to look like. We don't have that information, but we certainly want it to be very well considered and based on the evidence. So we'll have to just wait and see what the province is announcing today.
Thank you. Our next question is for Shannon. It comes from Richard from Moose FM. Is it concerning that over a fifth of the cases, so 22% in the last 7 days, were outbreak related from outside the district when the stay-at-home order is still in effect? Does this reinforce the need to keep following safety precautions?
Yes, thanks for that. Absolutely, it reinforces the need to continue to follow all of the public health measures that are in place and to continue to follow the provincial stay-at-home order until June 2nd, for sure. I think throughout the pandemic, we've advised the public to treat every interaction that you have as if the other person or wherever you're going, there might be COVID. And so taking all of those precautions is really, really key, because things can change in an instant in our district, and we're trying to keep case counts low. And the best way we can do that is protect ourselves and follow all the measures and get vaccinated.
Thank you. Our Our next question comes from Jennifer from the Nugget. It's for Andrea. When will youth age 12 and up be able to be vaccinated? Any timeline? I'm sorry, you're on mute.
You're on mute.
Sorry. Thank you so much for that question, Jennifer. We are in the process of planning a vaccination strategy for ages 12 to 17 at this point in time. We're working with our school boards and our community partners who work with children to develop the best strategy we can for this group. The provincial booking system will open for bookings for 12 to 17-year-olds on May the 31st. Our plan at the province's request is that we will be providing immunization clinics throughout the weeks of June the 14th and June the 21st to ensure access for 12 to 17-year-olds and their families to vaccines.
Thank you. This question is also for you, Andrea. It comes from Richard from Moose FM. As more and more age groups are added to the vaccine availability, are you pleased with what you are seeing with the number of people getting their first dose? Why or why not?
Thanks, that's a great question. We are seeing a significant uptake of vaccine throughout the district. All of our clinics are filling up, and we're very pleased with the turnout at the clinics and how well the clinics are running, and the fact that so many people are anxious to receive their vaccine.
Thank you. Our next question is for Dr. Chirico. It comes from Jennifer from the Nugget. The province is expected to announce a gradual reopening this afternoon. What would you like to see? Recreational facilities reopening, patios?
It's a very good question, Jennifer, and it really depends on the strategy that's going to be employed. And I'm certainly not privy to what is going to be announced. What I think is certainly reasonable approach would be to ensure that it's done slowly, it's done across the province. We've seen that if you have districts and or health units that have different openings and different restrictions, it doesn't work. So I'd like to see it throughout the province. I'd like to see it moving certainly slowly and be more sector specific as far as the reopening goes, starting with outdoor amenities, and that can be done safely. So it depends on what the sector is, what the amenity is. There's lots of variables, but we know that transmission is much less, certainly when people are outdoors. So if people continue to follow the public health measures, do it in a slow, progressive fashion, that everybody is in the same step forward, I think that's what I would hope for.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Is the health unit expected to receive additional vaccines next week?
Hi, Jennifer. Great question. We receive vaccines on a weekly basis from the ministry, and yes, we are anticipating we will receive our vaccines next week.
Thank you. Our next question is for Shannon. It comes from Jennifer from the Nugget. Has the health unit been in contact with the province regarding students returning to school? Would you like to see students back in school, back in the classroom in June?
So I'll just start by saying we would love to see students back in school when it's safe to do so and when the province feels it's safe to do so. So we still don't know. We still don't know this. So we have been in communication with the province. The province communicates regularly with health units, although we're not privy to any plans to reopen schools. So because the situation with COVID-19 changes rapidly, we haven't been informed what the province is planning. As always, we want to continue to take all of the appropriate public health measures and stay home to limit the spread of schools. And schools can and will reopen once the province decides the risk of spread is low. So a really important consideration, and we've said this before, an important consideration for school reopening is rates of community transmission. And our best chance of reopening schools is by continuing to follow all the public health measures and keep our case numbers really low and decreasing. And rates of community transmission need to be low and decreasing. So we're going to continue to follow the situation closely, and as soon as we know more from the province, we will update you.
I'd also like to add too, thanks for that, Shannon, in that we're currently working not only with the government, we're working with the school boards too, to plan for an eventual reopening. We can't say when that's going to occur. We'll follow the direction certainly of the government in this, but we're working very closely with them. They've done a superb job in the past, and it's been a great collaborative effort to ensure that we continue in the same step that we've had before, where we haven't had a school outbreak. Doesn't mean it can't happen, but we're working very closely with them to ensure that when we do open, that it will be as safe as possible.
Thank you. Our next question is for yourself, Dr. Chirico. Comes from Eric from CTV News. Throughout the week's long stay-at-home order, what do you think has been the hardest thing for people seeing other areas in the United States open up?
Yeah, it's been very difficult for everybody, and you know there are some that are certainly more affected by it, certainly financially, mentally, socially. There are those that are disproportionately affected by it, and it has been very, very difficult for that. I think that everybody has a unique situation, and it is very difficult too, especially when you see down in the United States what has happened, and that now they are opening up. And I think everybody would love to be in that position, but I think that we have to be very, very careful and look at the number of cases that we've had in Canada. We've managed to keep it, to a reasonable number and to avoid our healthcare systems becoming overwhelmed. So there's lots of factors. I know that the measures are tough, they're difficult, but we certainly have not seen the per capita large number of cases and deaths that have occurred in other areas. So, we just continue to follow the public health measures and recognizing that there are supports available for people's mental health as well as financial supports when needed, and we just have to work hard to get through this. And the hope is on the horizon. There is that light. We can see that coming, but we have to be very careful not to reopen too quickly, too soon, because we want this to be our last shutdown, and we don't want to see a resurgence of cases. So we need to continue to work, and then we'll have a prolonged reopening, and I think that's the best strategy.
Thank you. So our next question is for yourself, Dr. Chirico. Did the health unit provide any input into what the gradual reopening could look like?
We've been in contact, certainly daily, sometimes, and weekly basis with the ministry on many different aspects to this, and through our professional association with our Council of Medical Officers of Health, and there are also other tables for public health to provide input. So input has been given on that basis, yes.
Thank you. Our next question is from Shannon. It comes from Stu from Bay Today. In your mind, when does the focus shift to a September return to school?
Sure. Thanks for that question. So what I think I'll say about this is while we all hope that students can return to school as soon as possible, planning is already underway at the Ministry of Education and Ministry of Health level, and engaging with local health units and local boards for the return in September. So that planning is well underway. The youth vaccination strategy is part of that planning process. So I think it's early to say when that we shift the focus to really looking at that primarily, instead of wondering about will they return in June. I do think we need to wait and see what the province says and province announces, and it's less of maybe a shift in focus, but we're concurrently looking at both options and supporting planning for that. So hopefully that answers the question, but I don't know, Dr. Chirico, if you would add anything to that?
No.
Okay.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Follow up with Andrea. The province has designated 50% of their vaccine allotment to hotspots. However, that is scheduled to change. Could we see additional vaccines and additional clinics?
Thanks, Jennifer. That's a great question. The strategy that was put in place by the ministry is constantly being reviewed, and as the allocation of vaccines to hotspots starts to decrease, we do anticipate that additional vaccine would be available throughout the province for the hotspot areas to have as well. So it all depends on the response and the plans with respect to the hotspots, whether we'll receive any additional vaccine or any of that vaccine in the near future.
Thank you. Our next question comes from Clark from Cogeco News, Your TV, and this is for Dr. Chirico. Are we still receiving patients from out of town? What is the situation in our local ICU? Well,
all hospitals really are still on alert in case they have to be transferred. However, it's my understanding, and you best to verify with the hospital for any specifics, but we were informed that there is one patient in the intensive care unit and 3 patients that are on the COVID ward as of today.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Has the health unit found a new vaccination site as of August, as Memorial Gardens will no longer be available?
Hi, Jennifer. Thanks for that question. We are currently actively pursuing leads on potential sites for relocation of our clinics, and we are conducting site visits, and we will definitely keep the public informed of what our plans are for where we'll be relocating to.
Thank you. This question is also for Andrea. It comes from Eric Thompson. Just curious why you've opened the COVID-19 standby list to everyone now. Have there been a number of no-shows for booked appointments?
No, the reason that we've opened the standby list to everyone is that as more and more people become immunized, and now that it's open to everybody, our focus had originally been to focus on those individuals within the eligibility groups, and especially working with larger locations throughout the district. Now that we're open to everybody, and as the number of people we were identifying in larger sectors decreases, we felt it was appropriate to open it up to the general public now through this waitlist process.
Thank you. And our next question is also for you, Andrea. It comes from Jennifer from the Nugget. I know healthcare workers, long-term care workers are expected to get their second dose sooner than the expected 4 months. Could the average citizen expect the same thing, and how would they be notified?
There are ongoing discussions at the ministry level with respect to the interval dosing between first and second dose. We will certainly, if there are any changes, the ministry will make those announcements, and we will take our direction from the ministry, and we would also be publicly announcing that change if there is any change in the future.
Thank you. Dr. Chirico, this question is for you. It comes from Eric Tashner from CTV News. At our current vaccination rate, when can we expect our health unit region to have herd immunity?
That's an excellent question. Thank you for that. And the reason it's an excellent question is because everybody's asking it, because we don't have an answer to that. And there's just right now too many unknowns to be able to say specifically what we would have to have as far as an immunization rate. There's so many factors that are involved in that still we don't know how long the immunity lasts. There's some good indications that the vaccines are lasting. They're doing studies currently on all of this to determine that. We also have to determine, so what is the infection rate of those that we don't even know about? Not the positive cases, but those that are sort of asymptomatic or they've never been tested. And so there's studies ongoing to determine that, because that also will determine, how much of the population has immunity. So I don't have an answer to that, but as soon as more information becomes available, and that there is, and that will be up to the scientists and to really determine that information. So we'll be more than happy to provide it when more is known about that actual number.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. With the changes with the storage of Pfizer vaccine, it doesn't have to be stored in such a cold environment. Will that make it easier for the health unit?
The health unit follows the storage and handling guidelines that are provided to us from the ministry. So the current practices are that the vaccine is stored in a -80 freezer. It can be moved to a -20 freezer for up to 2 weeks, and it can be stored in a refrigerator for 5 days. And so we follow those guidelines very, very strictly. We have processes in place to manage that. And so though all of those requirements are adhered to, and we plan our clinics and our allocation of vaccine to clinics based on those guidelines.
And just to add, if the guidelines do change from the ministry and through the companies, and it's verifiable that yes, you can extend it in a normal fridge, then that really does help make it so much easier to be able to allocate it to different areas and different venues, if that's going to be possible to do, such as primary care offices, pharmacies, all of that. But we, as Andrea said, we follow the direction from the government as to what we're allowed to do. But we're hoping that that is going to certainly come into effect, because it does make it easier.
Thank you. So that is our last submitted question. So that will end our press conference for today. So thank you for everyone who was in attendance. The press conference will be available on our website later this afternoon as well. We'll see you back here next week. Thank you.